Hello and welcome to our program, Let's Talk About Mental Health. Bakit ako mahihiya? Yan po ay isang linya ng paboritong awitin na nagsasalaysay ng damdamin ng isang tao. Bakit nga ba tayo nahihiya kung meron tayong mga miyembro na pamilya na merong mental illness, mga mental issues? Yan po ang pag-uusapan natin sa episode ng Let's Talk About Mental Health. Mga kaibigan, we are very honored to have with us dalawa pong magagandang mga dalaga. Ngayon po ay reunion ng mga taga Bicol. Okay, yung isa dalaga, yung isa hindi. Okay, so I will be introducing to you ang ating mga guest for this episode. Ang isa po ay siya po ay registered psychologist at in progress ang kanyang doctorate in counseling psychology. Siya po ang chairperson ng Psychology Department ng Adventist University of the Philippines. Siya po ay isang mental health practitioner, certified assessment psychologist. Ang mga affiliations niya, siya ay associate ng Psychological Association of the Philippines, member ng ASEAN or Asian Association of Social Psychology, and consultant po siya ng Department of Health Private Rehabilitation Center. At marami pa po siyang mga trainings na napuntahan, but I will just mention yung training ng UPPGH sa Psychiatric Department or Psychiatry Department, Clinical Psychology. And then we also have, ang pinapakilala ko po ay si Sister Myrtle Orbon from Iriga City.
Magandang araw po. Salamat po sa pag-imbita dito sa programang ito.
We are very, very honored po. And then, ang sunod naman pong ating bisita, siya po ay isang preventive health educator. She completed her Doctor of Public Health from Adventist University of the Philippines. Siya ay nagtapos ng Masters of Arts in Nursing from Monash University sa Malaysia. And nagtrabaho po siya for many years as Health Director for Malaysia Adventist Mission sa Malaysia. And currently, she is the chair for Public Health Graduate Department of Adventist University of the Philippines, Dr. Jane Butabaraya.
Thank you for having me here.
Ay, maraming salamat po sa inyo. Salamat talagang malaki sa inyong dalawa sa pagpapaunlak sa imbitasyon ng aming Hope Channel. Okay, so ang pag-uusapan po natin ay about stigma, no? Ano ba ang stigma?
Ayun, so ang stigma po, ito po ay nagsisimula sa isang ating pananaw na ang isang tao ay kakaiba sa mga taong kinakasalamuhan niya or the people she's with. Like for example, I have a different activity, I have a different trait, and that makes me different. Now, siguro maraming nagsasabi na, ay pag may mental illness, mayroon kang parang stigma yan. Ayun, kasi if we will look at it, someone with mental illness, ay the way the person behaves ay hindi nga po talaga katulad ng karamihan. So, mayroon po siyang nararanasan na kakaibang behaviors at hindi naman niya hindi naman niya yung ginusto. And that's part of the characteristics or manifestations of someone like with ADHD, malikot, someone with depression, talagang nalulungkot siya na hindi naman niya yun. Kumbaga po ay sinasadya kasi as part of the manifestations or symptoms of the illness. Now, nagkakaroon ng stigma kasi ikumpara natin siya sa katulad niyang edad, siya ay meron kakaibang mga simptomas. And that's what make the person parang, ay, nasi-stigmatize, nalilabel siya. Ay, mukmukin siya, masyado siyang tahimik. Am I right,
Yes.
Dr. Jane? May
yung
dagdag natin doon na concept in public health perspective.
Yes, because stigma doesn't just happen one time off. It's a process It starts with labeling. Normal and abnormal. Napaka
Yun na lang
yes.
na abnormal na bata. Oo.
Ano yan, common yan sa atin. sasabihan na abno ka, sasabihan na stupid ka, siraulo ka. And it happens in a day-to-day basis. If a person is low in thinking, in thought, sasabihan na kaagad na abnormal. So, nalilabel siya kaagad. And from there, na-stereotype siya, na hindi siya normal. So, parang may division na doon kaagad. These people are normal, this one is not normal. So, stereotype. And then, from there, discrimination takes place. So, ganun yung proseso ng pag-ano natin ng stigma.
Kaya nahihiya yung mga mga relatives, mga kamag-anak.
That's
Kung
right.
meron silang kamag-anak na merong mental illness, no? Hindi nga lang mental illness, ano? Bakit nga ba tinatago yun? Dahilan sa
Yes, because people become embarrassed because it's not the norm eh. Hindi yan yung normal, and people don't want to talk about it. Parang tabu yan. Isa tabu.
Bakit nga may tabu?
Yeah, I think one of the Filipino perspective po na parang kinahihiya, disgrace in the family kapag merong ganitong sakit, na parang, lahi pa man din ng mga ganito
Yes,
yan.
correct.
Matatalino pa naman, nasobra ng
Kaya
talino,
lang.
kaya naabno, parang
Ayun.
ganon.
So parang, it shows a disgrace, social disgrace, and hindi siya tanggap sa community.
But, is it a disgrace?
Yun ba yung question?
Yes.
Kaya yun talaga.
It's napakahirap
Komplikado.
sagutin. Komplikado. Parang loaded na question yun. Is it a disgrace? Okay. As I'm a public health professional, right? And then we look at everyone the same. May kanya-kanya tayong mga kahinaan, may mga kanya-kanya tayong strength. Pero minsan kasi hindi mo rin maiiwasan na matawa eh. Yung mga oddities
Tumatawa
nila.
tayo not because not because ina-undermine natin
Yes,
yung
correct.
personality, yung person, pero yung sa situation.
Yes, correct.
Oo.
For example, one time, we were sending our niece to school, and sa school nila, merong isang bata na talagang a bit odd. So, meron siyang dalang laruan na para siya nagta-traffic police. So, he would put us a red light, and then everyone has to stop. And then pag mamaya-maya, anuhin niya ulit yung red light, yung green light, go na naman. So, tawa kami ng tawa. But then someone, my niece was saying, you should not laugh, But nakakatawa yung sitwasyon.
Kaya
So,
nga, kaya dapat maisip ng may mga kamag-anak na hindi naman actually tinatawanan yung yung
Correct.
person,
Yes,
but the situation. Yung iba nga hindi it's not to undermine, pero yung iba na-appreciate nga, no, 'di ba?
Yeah.
Na-appreciate nga na akala natin odd or abnormal, pero meron lang siyang kakaibang
Correct.
behavior.
Totoo po yan. Tsaka, to add on to that, ma'am, parang natutuwa tayo sa person, pero hindi naman natin ibig sabihin binubuli natin siya. But we actually love kung ano yung ginagawa niya. Pero at some point kasi, may mga iba na extreme yung ginagawa, na parang may mga dumarating na, kakaiba na siya. Kaya minsan, natatakot na yung iba, na baka kung ano yung gawin. Tapos sasabihin, anak ka ni ganyan, bakit ganun yung ginawa mo? Oo. So parang, that shows na may mga, minsan, uneducated po yung mga nasa community. And that could be one of the reasons kung bakit tinatawag na lang, kahiyan yon. Pero the truth is, I don't think it's really kahiyan, but there is really this poor education,
That's
much
right.
more the acceptance part of the family. Kasi there are some instances na sa ibang lugar po, hindi nila kinahiya, talagang they're happy about it. They go to the malls, and it doesn't really hurt them at all.
Kaya nga, malaking factor yung acceptance, no? Sa akin, no? Pero malaking factor ang acceptance. Pag in-accept mo na, talagang may anak akong ganito, no? Kakaiba lang ang ugali, but he's a part of the family.
Correct.
Pagkatapos, he's just different, and I love him. And kung ikaw mismo hindi mo kinakahiya, sino pa ang
That's right.
Diba? Sino pa ang mag-undermine at titingin dun sa anak mo? So, I think it should start from the family
family.
again.
That's
Oo.
right. Sa public health, ang tawag dyan ay socio-ecological model. Na ang ano talaga natin sa pag-atake sa mga ganitong issue ay starts from the individual, and then the family, and friends, and then the community, and then the whole society.
Yeah.
So, dapat sa individual, magkaroon ng openness.
Yes.
Na talagang ma-open niya, ma-accept niya rin sa sarili niya na ganun siya. Maintindihan niya kung ano nangyayari sa kanya. And the family needs to be open-minded na talagang i-accept at i-embrace yung peculiarity
Yes.
ng kanilang anak. And then only the society will be
Will
able
also
to
accept. Kasi,
accept.
tingnan mo, normal naman ang
Yes.
living nila sa family. So, may acceptance
Yeah.
din sa community.
That's
Oo.
right, yeah.
Yes, Doc.
Alright po. The other one po na I noticed yung binanggit nyo kanina na sa family nag-start and even the person must accept. But there are some mental illnesses po na wala talaga silang insight at all. I'm actually sick.
Okay.
So parang with that, wala silang idea na ay, hindi na okay yung functioning ko. And the ones who are aware na mayroon silang problema ay yung family. So with that, yung mga taong like for example, talagang wala na sila sa reality, the way they talk, pwede pong makategorize as probably having schizophrenia, yung talagang delusional
Yes,
na,
yes.
and they have no idea that they're talking na wala na sa reality. Ano po? So, anong nangyari? Yung family na yung talagang they're trying to hide. Huwag ka na lumabas ng bahay.
Yeah.
And
Oo.
history back then po will tell us that these individuals are actually parang kinukulong pa po noon.
Ayun,
Ngayon.
yun.
So,
Oo.
Yeah.
which is not good. Pero maganda na ngayon with the new law
Yes.
that we have, it is not actually advisable, but rather to receive treatment.
Correct.
Okay.
Actually, the bottom line here is education.
Yeah.
I mean, it is really good that the president signed the mental health law, and we are baby steps. Actually, very behind na tayo but it's a good start na talagang ang education ipaigting talaga sa local government unit, sa family, sa mga organizations ang mental health issues, yung mga demarcation, yung kung paano natin sila
Tataguyod.
itataguyod kung paano yung referral system, kung paano sila maka-access ng care. Napaka-importante talaga yan.
And I think that is elaborated dun sa mental health law, no?
Yes,
Oo,
definitely.
dun sa So napaka-fortunate natin. Yun nga lang, hindi pa masyadong naibabahagi.
Yes,
Kaya
correct.
we need to have massive information drive, and that
Yes.
is what we are doing now.
That's true.
No? So okay. So ngayon, merong ako, halimbawa, meron akong anak na merong merong mental illness. Pagkatapos ikinakahiya ko, no? Ang iba tinatanikala, they are being chained. Nalalaman niyo ba 'yon?
Yes.
Na there are some with mental illness na they are being chained. And then mas lumalala, 'di ba? Mas lumalala ang sitwasyon. What could be worse than yung mental illness? Kung chini-chain mo siya, pagkatapos ikinakahiya mo siya, itinatago mo siya, anong mangyayari dun sa person?
Yeah. I think with that kind of situation, lalong lalala yung sitwasyon ng bata and much more hindi ma-address. May naging recent case po kami niyan sa recent training ko sa PGH. Parang for the longest time, yung baby, not really baby, parang bata pa siya, nagsi-seizure siya. So, yung sabi nila, ay, ano lang yan, normal lang yan ang seizure. Parang, siguro, baka normal lang or what. Pero di ba po ang seizure, tama ba ma'am? Parang one of the symptoms of epilepsy. Ayun. And then, merong comorbidity of sa mental illness. But then, ang nangyari sa magulang, since hindi nila nga ina-address yun, it's a problem, hindi nila ni-refer for psychiatric help or for psychological help or even medical doctor. So, to make the long story short, 2 years yata may ganong sitwasyon yung bata. And then, nung na-check na nung doctor, lalo pong lumala.
Yun na nga.
Mas mahirap po tuloy matulungan.
Yes.
Kung in the long run, hindi na siya, para in the first place pala, hindi natin ina-address kung paano matulungan.
That's
yung
exactly
victim.
my point.
Or
Kaya
yung
sabi ko, it can be worse kung walang preventive measure
Correct.
na gawin. No? Kaya nga, ano ba ang mga dapat gawin ng mga nanay o ng mga tatay o ng family members na merong kamag-anak na may mental illness? instead na itago sila, ano ang dapat nilang gawin para maagapan. Meron na nun, pero
Yes.
pwede pang maagapan na magkaroon ng komplikasyon.
Yeah. It's a collaborative effort. Hindi lang sa family, pero sa komunidad din. Sa policy ng government. Meron na tayo nun, pero yung implementation natin sa primary healthcare, sa barangay level, parang wala pa. You know, sa barangay health center, meron tayong DOTS, TB, meron tayong maternal and child care, pero wala tayong section for mental health.
Okay.
So, para sa akin, as a public health person, yun talaga ang dapat paigtingin ng mga LGU. Kasi kahit na nga, halimbawa, sa family meron ganon, saan namin to dadalhin?
Tama.
Pupunta kami sa private hospital, it's very expensive. We can't even afford that. Yung mga psychiatric help, yung mga gamot pang iinumin nila. So, to me, I see it like dapat sa primary health
Yes,
level,
oo.
doon talaga dapat lagyan ng section sa barangay health center ng ganitong mental health na section.
Facility.
Facility.
Oo. Or,
Yeah.
tama ka. Kasi sabi nga sa World Health Organization na by year 2020, the number one mental illness would be
Yeah.
depression, and number 2 daw yan
Yeah.
when it comes to morbidity and
Yes.
mortality. So it will even surpass
Correct.
yung cardiovascular disease, cancer, stroke. Ngayon, ang gobyerno ngayon ay porsigido na labanan ang droga. And doon pa lang sa barangay level, meron na silang mga BADAC, Barangay Anti-Drug Abuse
Yes.
Council. Yun ngayon yung yun ngayon ang nagbibigay ng mga programa, no, para sa mga drug surrenderers. And I think your point, what you are saying is kagaya ng drug prevention na
Yes.
nasa barangay level, we should also come up.
Yes.
The government should come up. Kung hindi pa naisip ng gobyerno, siguro yun ang nasa sa
Yeah.
barangay,
Yes.
come up with a barangay mental health committee.
Correct. Yeah.
Merong sinasabi ang mga psychologists na meron na PFA, psychological first aid. At yung psychological first aid could be done in the barangay
Yeah.
level. So yun
That
kasi
can be done.
parang first aid yun sa mental, may mga biktima ng disaster.
Yeah.
So I think kayong mga nasa psychology department, mga health education department, let's come up with ganon, mga PFA for
Yes.
for
For
mentally
mental health,
ill,
yes.
mentally
I actually
ill
agree with that, Doc. Kasi
students or
recently
hindi students, patients.
there are recent studies na nagpapatunay talaga na kapag may access yung primary healthcare, mayroon silang access sa local government unit, bumababa yung rates of
Oh, yes,
suicide,
definitely.
bumababa yung rates of depression. And I think, ma'am, it was one of the research conducted in your department. Am I right?
Yes, one of my students conducted that mental health for teens. And during the time that she was conducting it, talagang bumaba yung kanilang mga depression. So talagang pag available yung mga support group na ganyan sa community level, the awareness heightened, the education heightened, and then na-prevent talaga ang mental health problems sa community. So,
Okay. So we talked about sa community. Ang church ba meron bang magagawa sa stigma na yan?
definitely.
How
A
can the
lot.
church
Yeah.
help in combating stigma?
Yeah, I think a lot. Pero honestly po, no, sa perspective ng psychology, there are some instances kasi na not really all po, pero several or some, parang hindi open to seek psychological help. May mga ganon. So parang isa po yun sa barriers for them to access psychological help. Parang they don't respect the psychologist, na parang, ay, okay lang yan, ipag-pray mo, ganito, mag-Bible study tayo. There's nothing wrong with that. But then, to emphasize the need for psychological help, even for psychiatric checkup,
Yes.
must be encouraged much more kung yung symptoms talaga
Correct.
nandun na. Ayun. So, lalo na kung suicidal, right? I think it calls for emergency help. Ayun. So, the church would really matters a lot.
Oo. Diyan
in
kasi sa
disseminating
church,
information.
ang church kasi, it's one big family. Na dun mo mararamdaman na, yung love, yung care, yung nurture. Kaya nga, sabi nga sa yung mga dalubhasa, dalhin mo lang siya sa church. Kahit mag-ingay yan sa church, as long as he or she is inside the church and can feel the love and warmth of the church members is already one way.
Yeah.
Na pinapakita mo dun sa bata na may mental illness na uy, kahit ako kakaiba,
Accepting.
accepted ako.
Yes. But the church members needs to be
Aware
educated
also.
and they need to be aware also. We can be service providers, but sometimes sa loob ng simbahan, tayo rin ang nagkakaroon ng stigma sa ganyan eh.
Kaya
So
nga.
yan ang pinakauna dapat nating i-break.
Kaya nga ang ano natin, we have to educate, but yung mga church members talaga have to have hands that would embrace,
Yes.
kahit na yung may mga mentally ill,
Correct.
o hindi lang mentally ill, yung may mga karamdaman
Yes.
na ikinakahiya ng iba. Okay, so we talked about community, we talked about the church, how about the family? Sa palagay ko, yun ang pinaka-importante.
Yes.
Yeah,
Oo.
right.
Yun talaga. Kaya nga sa socio-ecological model, ang family ang second level kasi sila talaga ang second level ng support, individual and then the family. So the health education, the mental health education need to be tailored to the family na mayroon talagang pangangailangan ng ganun.
Okay, if you now ikaw na ang nagka-craft ng yung
Yeah.
tinitailor made mo na sa
Yes,
akin na
yes,
meron
yes.
akong meron
Yes.
akong ano ang mga contents no nung mga gagawin ng
Well,
mga family.
First of all, yung mga risk factors muna ang titingnan mo. Bakit nagkaganon? Is it because of the genes? Is it because of peer pressure na nagkaroon ng negative influence? Is it the personality of the person as well, the lifestyle? And then yung family, titingnan mo rin yung dynamics ng family. Palagi bang nag-aaway yung mga parents kaya nagkaganyan? May mga unresolved conflicts ba na hindi pa na-address until now? So it has to be known first.
Yun
Yung
muna
pinaka-root cause.
i-address.
Yes.
You have to know the root cause
Yes.
first. Oh,
Yeah.
syempre, kasi mamaya, paimbabaw lang pala yun, di ba? Superficial yung
Yes.
ginagawa kasi hindi yung root cause. Yes.
To add on to that po, I think it's important for us to also consider the protective factors. Kung ano yung makakatulong sa kanya para wag nang lumala yung situation.
Within the family,
Yes, oo. Tsaka protective factors din po sa school. Kasi one of the most important avenues for education, I guess, and I believe is really university or school. So kung yung mga schools na affiliated, kung i-relate ko dun sa mga activities na pwedeng gawin, for us, it's really a challenge sa psychology department to disseminate education and campaign para yung family sa grassroots level, ma-reach out sila at magkaroon ng proper knowledge on how to actually address and manage those individuals with
Actually,
mental illness.
counselors can get access to the houses
Yeah.
of the student, no? And
Yes po.
they normally do interviews and they assess the
Oo,
risks,
oo,
of the
So,
family.
that's good, no? That's good to know na nagsisimula sa family. The family should have a happy link to the individual.
Yes.
Kailangan na siya ang source of joy, source of
Correct.
love, source of compassion, because supportive, protective
Protective.
factor. Then sunod doon, family. Number 2, ano na nga?
The community, yes.
So
Which
ang
includes either school,
School,
or
church,
the barangay.
or the barangay.
Yes.
Yes.
Okay,
Yun na yun.
So pag merong ganon, siguro
That is
wala nang
really that is the model that really will work sa ganitong klase. You need to collaborate lahat ng mga agencies na pwedeng tumulong sa tao na may mental illness.
okay. Now marami na ngayon ang may mga kamag-anak na may mental illness, mental issues. Ano yung masasabi nyo? Your last word, parting words, sa mga taong ikinakahiya pa rin ang mga kamag-anak na may mental illness.
I'm sure it's not an easy task for someone with that kind of person you're taking care of. lahat ng resources ubusin mo para sa anak mo, lahat ng avenues you will try all the possibilities. But the first level is really acceptance. When you don't accept, you will not love.
Yes. Tama,
So
tama.
I think that is the very barrier that you have to buwagin mo muna yan. I-accept mo in totality
Kayo
kung
mismo,
sino man yan. And then love the person without ifs, without buts, and without whys. I know it's not easy, but again, it's a step of faith for every family. And I hope that they will really be blessed by the Lord as they continue to love this kind of, these people.
Okay. Thank you, Dr. Jane.
Yeah, for me naman, there will always be blessings in disguise. So if we find it heavy for us to have a family member or friend with mental illness, wag po tayong matakot at wag natin ikahiya. Ayun. So wala pong masama na nakasama sila sa labas kasi they deserve to be loved and to be treated very well. And in the end, it will make a happy family and a happy community.
Okay, thank you so much, Dr. Jane,
Thank you.
Dr. Orban. So maraming salamat po. We'll be right back right after this.
Ang buhay ay isang paglalakbay. Minsan mahirap, minsan ay madali. Subalit ang taong lumalakad sang-ayon sa mabuting payo at ang kaniyang ligaya ay sa Panginoon, ay siyang tulad ng isang kahoy sa tabi ng tubig na nagbubunga ng masagana.
Welcome back dito po sa program natin na Let's Talk About Mental Health. Ito po ang inyong kaibigan, Lalaine Ceron Alfanoso. And at this time, I would like to introduce to you our guest or resource speakers. Meron po tayo ditong isang matipunong lalaki. Ano ho? Siya ay registered psychometrician, may master's MA in counseling psychology, and then instructor po siya sa Adventist University of the Philippines ng Positive Psychology. Siya po ay isang mental health practitioner. Ang affiliation niya, siya ay associate ng Psychological Association of the Philippines at member ng Philippine Mental Health Association. And I would like to introduce to you Mr. Ralph Guangco.
Thank you for having me here once again.
Thank you also for accepting our invitation. And then we also have the chair of the Graduate Psychology ng Adventist University of the Philippines, registered guidance counselor, and siya po ay nagtuturo both in the graduate and undergraduate level sa Adventist University of the Philippines, and ang kanya pong counseling profession ay 23 years na. So mga kaibigan, pinapakilala ko po sa inyo si Dr. Mylene S. Gumaraw.
Thank you, Ma'am Lalaine. This is my third time to be with you in this program.
Okay, parang first time pa lang po.
Yeah.
Parang first time pa lang ngayon kasi magkakaroon na naman tayo ng bagong huntahan.
Okay.
Okay, we will be discussing about, how to combat stigma. Marami na kasi napag-usapan sa unang segment kung ano ang stigma, bakit may tabu sa stigma, bakit ikinakahiya ang stigma. And we talk about the different advocacies sa church, sa community, sa school, as well as sa family. So we talked about it already. Ngayon, ang aking concern, what if meron na talagang individual na label na, no? No? 'Di ba? Meron nang na-label kapay-kapay. We call it kapay-kapay in our dialect. Oo. Sintu-sinto or kaya yan ay abno. Yung parang ganon. Na-label na, buwang-buwang. Na-label na siya. Ano ang mga interventions na pwedeng ibigay sa mga high-risk individuals? Sir Ralph?
First of all, syempre, we have to recognize. Actually, mayroon tayong natawag na 3-step intervention. So the first one is to recognize.
Okay.
So in recognition, there are several things that you need to consider in recognizing the individual's mental health.
Okay.
So the second one is the.
Are you going to elaborate on that later?
I'm just say all the three first.
You just want to
So-
enumerate the three first, then you elaborate.
Yeah.
Okay.
The first one is recognition, so what I have
Okay.
said. The second one is the action. So you talk about it.
Okay.
And the third one is the assessment. Yung una at yung pangalawa, kaya ting gawin yun. Everybody
Okay.
could do it. But the last one, the assessment, should be done by a professional, a mental health practitioner, a mental health professional in that specific field.
Okay.
So the first one, when it comes to recognition,
Is
we need to be aware.
recognition.
Yeah, recognition. We need to be aware of the things that the person is presenting to you. For example, number one, recognition of the person, how the person thinks.
Okay.
How the person thinks. For example, tatanungin ko po kayo.
How the high-risk
Opo.
individual thinks.
How the high-risk
Okay.
individual think. Tatanungin ko po ang isang individual. For example, ilang taong ka na? Sino ang nanay mo? Saan ka pinanganak? Anong araw ngayon? Yun po yung mga basic questions that could be answered ng isang individual na tama pa yung pag-iisip. Pero if an individual, if an individual's thinking is not okay, then the person would answer differently. For example, tatanungin ko, anong pangalan mo? Ako
14 years old na ako.
14 years old na. Ako ay artista na
yun.
si Richard Gutierrez. Okay, ganun.
May feeling of grandiosity na. no?
Sa kanyang cognition. The second one, first is the cognition. You need to recognize the cognition of the person. The second one is the affect.
Going back to recognition that he is
the visible signs.
yung hindi na norm, hindi
Hindi na nararapat. So, number two is the affect or the person's emotions.
Okay.
So, you need to identify if the person is distressed or having an anger problem. So, that's one indicator ng para ma-recognize mo yung isang condition ng isang individual. The third one, elaborate ko lang po para mas maintindihan natin para mas ma-recognize natin or yung those are the visible signs ng isang tao na maaari nating matulungan. So, una, cognition. Second one, affect. The third one would be the speech.
Okay.
How the person speak. Maaring mabilis masyado. Hindi na maintindihan ng isang...
meron na ganyan.
Nag-stutter na.
Nagsa-stutter na.
Oy, baka naman ako'y may mental illness. Kasi nag-start.
Opo.
Okay.
So that's the third one. The fourth one would be the thought patterns. So thought
Yung mga
patterns, kung paano siya mag-isip, kung paano niya i-handle yung mga circumstances. Bigyan mo siya ng sitwasyon. Ano ang gagawin niya? So maaring iba ang sabihin niya sa'yo.
Like what?
For example, sasabi, ano ang gagawin mo kapag nagkaroon ng sunog sa isang sinihan? Isang tanong lang yon.
Okay.
Maaring ang sasabihin niya ay iba.
Ano?
Sumigaw.
Okay.
Tama ba na sumigaw? May mga tama dapat na gagawin. Isabi sa
Police, tumawag sa bombero.
Ang gagawin niya lang sisigaw. Would that be okay? Would that be deemed as normal? Kung sisigaw lang siya, sisigaw lang siya ng sisigaw. Would that be okay? Kailangan dapat ma-assess natin yun kung tama ba. Isang indicator lang yun.
Oo. So, paano kung merong mga taong sasabing, sisigaw ako. Sisigaw for help.
Nang may sunog.
Cry
Sisigaw,
for help. Or siguro yung, paano kung may nasunog na, anong gagawin mo? Eh di, sasayaw na lang.
Yun. May mga ganun din
Yung
po.
parang ganun. Yung out of the blue, yun ang mga isasagot. Ganun ba? Kasi yung sisigaw, parang lahat ng tao
Pwedeng
ganun ang
sumigaw.
gagawin.
Opo.
Oo.
Pero yung sisigaw lang talaga siya at walang gagawin, that's something different na. Nasisigaw lang siya sa sinihan habang nasusunog, hindi siya tatakbo, hindi siya maghihingi ng tulong. So that's one thing na dapat nating i-observe kung mga ganun. One explanation lang naman yun. And the fifth one would be the appearance. So the person's
Hindi na
hygiene,
naliligo.
untidy. So kung makikita nyo sa mga yung mga street, po natin dyan.
Hindi na nag-ano ng balbas.
Opo, mga ganun. So, makita po natin sa kanilang pangangatawan kung hygienic pa ba sila, may problema ba sila doon. Kasi
Hindi
nga,
nagtututbrush.
so that would affect the person's
Kasi ang normal na
mental
tao,
health.
nagtututbrush, naliligo, oo. nagpapabango. Oo.
So kung titignan po natin yon, those are the visible signs.
Yun ang mga
Oo.
recognition. You have
Recognition,
to,
recognize the visible signs.
Parang recognition and identification.
You identify those 5 things.
Yeah.
Mga ano lang po yun, parang indicators.
Okay.
Pero hindi po natin masasabi na may abnormal na agad sila. There will be an assessment which
In your
is will be
case,
there.
in your experience, Dr. Gumaraw, meron na ba kayong na-identify by using the 5?
Yes, a lot. Actually, yung mga dapat i-recognize to add to what he said, recognition of the warning signs. Yung warning signs na activities or responses which is out of the blue or beyond, which is beyond of what is supposed to be said, beyond of what is supposed to be doing. Like for example, may dinala sa'yo na client, tapos apektado lang, naapektuhan, umiiyak lang. Pagkatapos, upon interview, may hawak-hawak siyang something. Pagkatapos yung something na yun, hindi niya namamalayan, meron ka rin dyan. Di ba sa office natin, may mga alcohol, may tubig. Tapos kung may hawak siyang bread or whatever, yung tubig, ilagay mo doon sa bread mo. So, it's something na hindi niya na alam kung ano yung ginagawa niya. And then, I have also experienced asking an individual just to verify whether he is on the right thought pa. Where are you at? I'm on the way to heaven meeting San Pedro or I'm on somewhere else na it's...
O baka nag-joke lang naman.
Joke, pwedeng joke siya, pero malalaman mo ang joke based on the consistency and pattern of
So that's
responses.
how you identify a joke
Pattern of
or-
responses.
okay, oo.
Like, ulitin mo ulit yung tanong. Let's say, dalawa kayo. So, dapat kung may facilitator, may co-facilitator, the same question will be asked, pero kung ang sagot is in a form of joke, pwede pa rin mag-third question. Pero kung ang sagot ay consistent na out of the blue, o kung ang unang sagot, where are you at? Nasa guidance ka. Ang sagot mo, I'm on the way meeting San Pedro. Yung pangalawang tanong naman, where are you at? I'm in Paseo, pero naandoon ka. Pero makikita mo naman sa mata kung siya ay nagbibiro or hindi. And ang mga ganyang tao, based on appearance, blank ang stare. Parang looking through, lampasan yung tingin.
Naku.
Hindi siya makafocus pagkatapos
Hindi
yung
maka
Eye contact.
eye contact pagkatapos habang kinakausap mo may dinudukdok dyan or may ginagawang,
ginagawang iba.
Minsan nagfi-fidgeting sila or kung naiinis at yung source ng depression nila is hatred, meron siyang pupunit sila ng isang bagay or even their own clothes ay pupunitin nila. So those are symptoms or signals na kailangang bigyan ng pansin.
Okay. So aside from recognition, we have action.
Yes po.
Okay.
So when it comes to action naman, siyempre, kailangan nating, pag may nakita tayong mga ganun, hindi lang natin tititigan. Titignan lang natin, uy, sintu-sintu,
Kawawa
buang,
naman.
abnormal,
Or
sinasabihin
kaya
natin ng
usual
mga
na
ganun.
ginagawa natin, kawawa naman yun. Pero wala tayong
Wala tayong
ginagawa.
ginawa.
Opo. Lalo na po tayo nasa ministry na mga ano. So nakikita po natin yung mga kondisyon ng ganon. Lalo na mga mental health practitioner at yung mga normal na mga tao na kung saan nakikita nila na doon na nagwawala, nakahubad. Wala silang ginagawang mga ano.
So what action should we do? Anong gagawin natin bilang concerned citizen? Halimbawa, may nakita tayong yun nga, sinto-sinto, may nakita tayong hubot-hubad, no? Alam mo, ang mga taga Department of Social Welfare and Development, ayaw nilang makialam yung iba. Kasi baka raw
Masaktan sila.
masaktan or baka manakit, no? Or kaya baka dahilan sa merong tumutulong sa kanila, pabalik-balik, pauli-uli na. So ano yung action na sinasabi mo?
Kailangan talaga ng you initiate a conversation.
Okay.
Just by talking to that person,
So yung talk therapy.
Opo, pwede na agad, kung baga, pwede nang maiano yun. Pero depende po sa sitwasyon.
Oo, baka
Kasi
naman hubot-hubad,
maaari-
kailangan ko itong i-talk therapy.
Ini-initiate mo ang conversation pero na mayroong problem. Pwede kang saktan. So,
yun na
be
nga.
careful din po sa mga ganong bagay. So, clarify mo yung situation, ano nakikita mo. If you cannot do something about it, refer mo talaga.
Yes. I think
Bumili
that's
ka
the
ng tulong.
best,
That's the
no?
best thing that you can do.
Oo. Halimbawa, may nakakita kang hubot-hubad nga kasi may mental illness. So, ang action natin doon is refer it to the agency concerned, no?
Opo. Lalo na po yung mga mga emergency cases, psychiatric emergencies tulad ng suicidal.
Ayun,
Yan
oo.
ang pinakamatindi dapat na ating i-focus. Hindi yan basta-basta lang na problema lang eh. It needs immediate attention na kailangan talagang referral niya na maipadala agad sa clinic or any na facilities na nagdi-deal sa mental health.
Minsan kasi binabaliwala, no? Or kinikibit balikat lang natin. Minsan meron kang natatanggap na na text message. Magsusuicide na ako. Dalihan niyo na lang ako ng bulaklak sa kandila, no? Minsan may mga ganon.
Opo,
So it's a cry for help,
Yeah.
no?
Actually, I have one experience sa dorm, di ba? In the middle of the night, at 12 o'clock, somebody knock at my door. So, I immediately, parang naalimpungatan po ako eh. Tapos, pagbukas ko ng pintuan, "Sir, can you help me, sir?" Kasi nag-cut na po. Nag-cut na ng kanyang wrist. Tapos, kinausap ko, what's the reason for that? Pero, tinawagan ko na agad ang parent, immediate concern eh. Kailangan na talaga ng immediate attention yon. So, agad-agad, pumunta ang magulang at, "Sir, wag niyo pong iwan." Kasi dapat talaga hindi sila iniiwan eh.
Tama.
Nandoon ka sa presence nila all the time bago dumating yung tulong.
Oo, so we really have to make action and it should be fast.
Yeah.
Yeah, very fast.
Or else it might be too late. Okay.
Yeah.
So we're done with recognition, action, and then
action.
assessment.
Yeah. Before the assessment, can I add some?
yeah, please.
Okay. Sa educational setting like ours, mas maganda kung merong process flow. Ang process flow, kung saan mo na-recognize, first yung recognition, saan mo na-recognize yung bata na merong mental health problem or concern. And so, kung may process flow, yung step-by-step procedure, masusunod natin yun. Let's say, halimbawa, yung sinasabi mo, nakita mo na lang, umiiyak sa ilalim ng puno, or sa isang building, nag-iisa, umiiyak, anong unang gagawin? So, kung may process flow at known sa buong campus, yung process flow, kung ako nakakita at kaya kong dalhin sa guidance or sa clinic, dadalhin ko yan. Pero kung hindi, ang next step is ano ang dapat kong gawin. Tatawag ako ng security ba, ng guidance or personnel, or ng clinic. Pero ang medyo challenge sa atin is, what if hindi sa educational institution nangyari? Let's say sa street. Nakita natin may hubot-hubad. Kasi parang common na yung taong grasa, yung mga hubot-hubad, siguro may matinding problema, naglayas or what. So, ano kaya ang magiging role natin doon? So, ito is very hindi pa clear para sa atin lahat, na mamamayang Pilipino, ano ba ang dapat gagawin?
Okay.
Kasi, like what you have mentioned, na meron tayong mga boundaries.
Okay.
Minsan, hindi tayo pinahihintulutan ng mga law enforcers na makialam dahil meron silang right procedure na ginagawa para dyan.
Okay. So, maganda yun na may process flow. So, everybody in the community and in the school setting, no, in the community, in the school
in any
setting, should know the process flow or the protocols.
Yes.
Para kung may mangyari man yon, kahit wala yung mga administrador, alam niyo kung saan i-refer. That's very good. Okay. So, going back to assessment.
Opo, when it comes to assessment, it's not, hindi siya basta-basta lang ginagawa na assessment. That's
Who can
why,
assess? Who can do that?
Psychologists, yung mga medical practitioners, they can do that assessment.
What kind of assessment ang ginagawa?
Assessment with in-depth assessment po ang ginagawa kapag ang condition na ay matindi na. Hindi na basta-basta lang na condition na masakit ang tiyan, masakit ang Pero yung mga tagang sabi ko nga po kanina, suicidal cases. So that needs an in-depth assessment talaga na kailangan talaga na papuntahin sa isang
who can do that?
practitioners. Mga psychiatrists.
Psychiatrists
or psychologists.
and psychologists.
Opo.
Clinical
Or clinical practitioners who are trained to do that.
Okay,
So, dapat trained talaga kasi hindi pwedeng basta-basta lang na magaling ka dito, magaling ka dito. Pero hindi mo naman alam ang dapat
Yung
gawin.
right procedure.
Right procedures. Okay, ayun po.
Okay, so i-refer mo siya either psychiatrist or psychologist. Now, kalimbawa ako ay may kamag-anak na merong mentally ill, no, na patient. And then how would I know kung saan ko siya i-refer? Psychiatrist ba, sa psychologist ba, kasi gusto kong ipa-assess. Okay, so ano ang magagawa ng psychologist at ano naman ang magagawa ng psychiatrist?
Okay. Initially, kung relatives, yung pinakamalapit. Let's say, malapit ka sa school, so pwedeng pumunta sa counselor. Pagkatapos, sasabihin naman ng counselor, if the severity or the situation is beyond the capacity of the counselor to deal with, hindi niya gagawin yon. Pero may initial assessment siya. Katulad ng sinasabi niya kanina na recognition. So, upon arrival doon sa office, kung ano ang observation niya, yung mental health, mental status examination, i-jot down niya yon. Tapos, pag dinala na siya doon sa specialist, naka-attach na yung observation niya.
So that's the process?
Yeah, the process. Now, kung kasi sasabihin ng counselor na this is beyond my capacity to do the assessment.
You refer it to the
So,
psychiatrist.
magre-refer ako, then ako din ang tatawag na si Dr. So-and-so, may dalang pasyente, so please accommodate. So,
Tama.
yung mismong first person na pinagdalahan mo, siya ang magko-contact doon sa tao na kung saan siya i-refer.
So the psychologist usually do more talk therapy, counseling, and then the psychiatrist
Medications.
bibigay naman ng treatment, yung medications.
Medications.
Okay.
Opo.
But the assessment dun sa
Yung in-depth assessment will be done by either psychologist or
And the
psychiatrist or any
psychiatrist.
clinical practitioner, trained clinical practitioner. Pero yung simple assessment like yung MSE, that could be done by guidance counselor.
Okay. So, yun nga, yung assessment cannot be done by persons like me, no? So, yun lang ay magagawa ng mga medical practitioners or mental health practitioners. Okay. Now, gusto kong malaman ng ating mga listeners pati kung ano ba ang rights, no? Rights ng mga mentally ill patients.
Okay, we have many rights when it comes to concerning mental health patients or clients, individuals, like access to health care. So, based on Republic Act 11036, meron tayong mental health law. And the goal of this law is to promote the mental health of the individual.
Okay.
And so, I just don't know kung yung pinirmahan ni President Duterte just recently ay amended na ito, pero sa proposal, kasama doon yung this will be included in the PhilHealth.
Okay.
So, kapag ka nagpa-doktor ka, nagpagamot pertaining to mental health, covered na siya ng PhilHealth.
Kasi noon wala pa.
Wala
no?
pa noon. At saka nagiging open na rin ang Pilipino sa pag-access ng mental health care. Kasi dati nga, nakakahiya. So ngayon, Filipinos are becoming open to it because very rampant na ang cases ng mental health. And then another one is access to education. So anybody has the right for education, pero may certain limitation also and boundary. Like we have to apply the principles of inclusion and exclusion. So sa principle of inclusion, kahit na medyo mayroon kang difficulty, ikaw ay mayroong exceptionality, so kailangang tanggapin ka, at kung kinakailangang i-mix ka sa mainstream or doon sa like the majority, then the school has no right to reject the individual. Maliban lang, pero may mga certain requirements ang certain university or certain school na kailangang i-produce ng parents, like clearance from developmental psychologist or psychiatrist. Pwede ba siyang mag-aral? Ano ba ang mental capacity niya? Siya ba ay 10 years old, pang grade 1, pang grade 2, or saan na ba ang level niya? So may ganong clearance. Kasi meron din kaming experience na gustong mag-college kasi tinanggap sa isang eskwelahan because of, you know, yung sisterhood and brotherhood. And so, pero yung bata may manifestations ng tic disorder and yung nanginginig-nginig. Pagkatapos, nagsasalita siya ng walang kausap. And so, kapag i-mix mo siya, nadidistract yung marami. So, ang ginawa ko ay hingi ako ng clearance na kung pwede siyang mag-college. Pero ang sabi naman ng nanay, meron na po. Then binasa ko, ang nakalagay doon sa clearance cannot be mixed with mainstream. Pero ang sabi naman ng nanay, nagbaka sakali lang po ako na dahil since this is Adventist school, baka pwede. And so sabi namin, pwede din po training purposes pero but not yung formal education. So meron tayong inclusion and exclusion. Now, alin ang mga bata na i-exclude mo? Let's say, hindi dineclare ng parents. So parang may counting partly may deception. And then along the way, na-recognize mo na ang bata may problem. So kung disruptive na bata, yung destructive na yung bata, nakaka-apekto na sa majority, then the school has the right to make a suggestion whether for home study or online learning na lang.
Okay. So there are many ways, no?
Yes.
Yung sa right
But they have the right for education.
right for education.
Right.
Okay, 2 minutes lang, but we have to wrap up. But this is very important, no? Why do we have to focus on mental health? Why is it important na mag-focus tayo sa mental health, no?
Ayun po. So according to the World Health Organization, there is one fact. And fact number 6. Yeah, there are 10 facts. But then again,
we
we'll
will
just
focus on
focus on our fact number 6,
Okay.
which is stigma and discrimination against those with mental health conditions prevent them from seeking mental health care or mental health care. So difficulty nila yon kasi nga they are stigmatized. They are labeled na baliw yung pamilya nyo, baliw ka sa pamilya nyo.
Sinto-sinto.
So yun yung number 1 fact. Bakit na tayo kailangan mag-focus? Because maraming mga ganun nangyayari sa atin sa kasalukuyan, sa society natin ngayon na nililabel yung isang individual na baliw, abnormal, na dinajudge agad-agad. Yun.
Okay.
Sana yun.
Yeah.
So, what's your last words? Parting words.
Parting
hindi,
words. Parting
words.
words for those who have mental health concern. Sana bigyan din natin sila ng consideration na sila ay human beings din.
Yes, oo.
Now, if ever they thought na totoo, the fact na hindi sila within the majority, they don't belong to the majority. Now, still okay kasi you just think of it. But if you put into action what you think, that is discrimination already.
Tama.
So we should not discriminate those because they are also human beings.
Okay.
Then we can put ourselves into their shoes para maintindihan
Tama.
natin
Kung anong
ano ang
nararamdaman.
nila.
Tama. Okay, Sir
Sa
Ralph.
akin naman, sa ating mga manonood, do not judge that ye not be judged.
Yeah.
So
Yes.
kailangan natin wag manghusga ng mga tao na hindi pa naman natin kilala. Kilalanin din muna natin yung sarili natin. Baka rin tayo ay may mga kondisyon na kailangan din natin ng tulong.
Tama.
So maraming salamat po.
Maraming salamat. So, napakaganda, interesante. Maraming salamat, Dr. Mylene Gumaraw and Ralph Guangco, Sir Ralph Guangco. Mga kaibigan, labanan po natin ang stigma. Ang mental issues ay, ito po yung nakuha ko sa inyo, maaalalayan, masusolusyonan, maaagapan, at magkakaroon ka ng katiwasayan ng kaisipan. So, kung meron po kayong miyembro ng pamilya na merong mental health issues, go out and reach out, no? Kasi he could be helped. There is still hope. Maraming salamat po. Ito po ang inyong kaibigan, Lalaine Saron Alfanoso.